case study discussion regarding robots to assist in neurosurgery, which helps neurosurgery to perform using ROSA. Can anyone tell me what is ROSA and how this the case is discussed? Okay.
Neurosurgery is a specialized branch of surgery that deals with diagnosis and treatment. It is also surgical management of disorders affecting the brain, peripheral nervous system and spinal cord. And let us know about what is ROSA. ROSA is a robotized stereostatic assistant which helps the surgeons to treat epilepsy in precise electrodes, and it is an invasive method, and it is developed by Zimmer Biomet, and it is a procedure which is used in this is brain tumors, spine, and for complex surgeries this ROSA is used.
Okay, now let's discuss the background of this case study. Here the 28-year-old female patient suffered from drug-resistant epilepsy. Her seizures originated from deep brain regions, which is difficult to access via traditional surgical techniques. And also conventional surgery poses high risks of complications and require long recovery time. So the problem here is difficulty in accessing seizure foci with minimal invasion, and risks of damaging healthy brain tissues, and we need of high precision real-time navigation through 3D systems.
So the solution for this problem is the ROSA, and ROSA is used because it is minimally invasive and it can accurately find the focus of the seizure. So the procedure begins with the pre-op. So the pre-op involves imaging the seizure site using 3D imaging technologies like MRI and CT. We use 3D imaging because seizure sites lie deep within the brain, and it's hard to identify using the normal imaging techniques. Then after finding the site of the seizure, we have to set the coordinates in the ROSA, and these coordinates are called stereotactic coordinates, and they are set by the operator. Once the coordinates are set in the ROSA system, next we have to the ROSA system guides the operator to place the SEEG electrodes, that is the stereo electroencephalography electrodes on the brain. This helps us to find the seizure zones in the EEG. Then we have to perform real-time monitoring. The patient is let to sit for some time, and their brain signals is monitored. So real-time monitoring helps us find the seizure zones in the normal EEG signal. Once the seizure focus is identified, we have to reset the part of the brain that is causing the seizures.
Okay, let us see the advantages and benefits of this robotic surgery. High precision. ROSA provides sub-millimeter accuracy for targeting the deep brain surgeries and minimally invasive. It's very minimal invasive, and it helps to faster healing and reduce the trauma for the patients. Time of the surgery. It reduces time by 40% compared to the normal surgery.
Increased patient control, shorter operations, less invasive technique, and fast recovery. And patient can often leave hospital sooner by using this technique, ROSA technique. And it supports a complex and deep brain access, as ROSA enables a deep and multiple seizure sources which are hard to reach a conventional method. And it is ideal for complex tumors, and it is repeatable and reliable on the outcomes, and it improves the overall success rate of epilepsy surgery. And multifunctional system, like it can assist in a range of procedures like sage biopsies, tumor resections, and laser ablation, and more. And future integration with AI. And in future, it might be AI can be assist the ROSA, and it can be implemented in further use.
Okay, now let's see the applications of neurosurgery. Neurosurgery has wide range of applications, which is primarily focused on diagnosing, treating of the brain, spinal cord, and peripheral nerves. Which includes brain tumor removal, epilepsy surgery, aneurysm, spinal surgery, deep brain stimulation, and trauma management. Okay, hope you all came to know what is the ROSA surgery is about, and applications and advantages has been discussed clearly. Can anybody conclude the session?
Yes, I would like to conclude this session. The use of ROSA brain in neurosurgery for epilepsy significantly improved outcomes and demonstrated the potential of robotics and automation to enhance precision, safety, and recovery in complex brain surgery.
Okay, hope you all came to know about the ROSA surgery. Thank you for the discussion.
Thank you.